Klay Thompson's looking awesome. His injury rehab went phenomenal. The Warriors are ready to hit the ground running and jump right back into contention. And then, boom, just like that, news of another injury for the Warriors superstar. Whew. Deep breath. Let's talk about it. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. In this video, I'm gonna react to this news, try to break down some of the different pieces of what we've heard, take a look at some of the anatomy, kind of talk through some of the different concerns here and what they're gonna do to work this up. As always, if you enjoy learning about this unique side of sports, please consider subscribing and be sure to go follow me over on Twitter for more real-time breakdowns and analysis, and let's get to it. Key point #1, Klay Thompson is coming off of rehab for a left ACL tear, and the reports are that this injury is his right lower leg. The initial report was simply his lower leg. In strict medical terms, the region above the knee but below the waist is generally considered the thigh. Technically, you could call it the upper leg, but really if I'm talking to another medical provider and I'm talking about like a quadriceps injury or even a hamstring injury, I'm going to say the thigh. To me, lower leg means, in broad terms, anything below the level of the knee. More specifically, if another doctor tells me someone has a lower leg injury, I'm typically thinking of the space between the knee and the ankle, just because if it was the foot, somebody would say foot. If it was the toe, they'd say toe. If it's the knee, they're gonna say the knee. So to me, lower leg typically means somewhere between kind of the ankle or the heel and the knee joint. So, initial fear when you hear about somebody with a lower leg injury, there's so many different possibilities here. If we look, basically I've got all the key kind of musculoskeletal structures here of that entire lower limb. So lower limb, everything in the leg. And, we've got a number of different muscles here. We've certainly got the tendons of those muscles where they insert down by the ankle. Of course, the big fear here was the Achilles tendon because yes, that technically is part of the lower leg. But this, when we just hear lower leg, could have been anything from a fracture of his tibia to simply just a contusion or a bruise of his heel. Shortly thereafter, we got some reporting that the concern is actually a right heel region or heel area injury for Thompson. So now we can narrow things down a little bit and kind of zoom in on this general region of the heel. But remember, the heel is not just the Achilles tendon. There's a lot of other stuff here, both on the underside of the foot near the heel bone, the backside of the heel, even kind of here on the inside and the outside. Before we dive into specifics about a heel injury, I want to give a quick shout out to the sponsor of this video. If you're one of over 80 million Americans fed up with paying high price for cable TV and dealing with those shady companies, there's finally an alternative for you to get that cable TV experience at half the price. It's the sponsor of today's video, Fubo TV. Fubo TV features over 100 of your favorite channels, including all the major sports networks and my personal favorite, the NFL Red Zone. You can watch live games in 4K, and with Fubo TV's cloud DVR, you can record and watch your favorite shows at any time and any device. Simply put, no other streaming service can compete with the breadth of entertainment options that Fubo TV offers, plus it's going to come in at half the price of cable. You can get signed up in minutes for a risk-free trial period, and it doesn't require a cable box to get started. Head over now to FuboTV.com/BrianMD to get a free trial period plus 15% off your first month. That's FuboTV.com/BrianMD to get a free trial period and 15% off your first month. Links in the description below. Once again, that's FuboTV.com/BrianMD. So thank you again to Fubo TV for sponsoring today's video, and let's get back to our learning. So now if we zoom into the heel, we can kind of forget about some of the things like, the tibia, the calf muscles, stuff certainly up by the knee, and probably rule out a lot of stuff down in the foot because let's be honest, they probably would have said foot. So what are the key things to talk through here with our heel anatomy and possible injuries? Let's not ignore the elephant in the room, the Achilles tendon. Your Achilles tendon is of course the big long tendon that runs down the back of the leg, inserting on the heel bone, which is referred to as the calcaneus, and is the tendon that is formed from the calf muscles or the gastrocnemius, the soleus muscle, and then also sometimes part of the plantaris muscle. When you hear about a severe heel injury in an athlete, of course you're going to want to evaluate and have an Achilles injury pretty much right at the top of that differential. Now there are kind of in the back side of the heel, there are some deeper tendons, specifically these tendons that are flexors of the foot that flex the toes, kind of help point the foot downward. But those are going to be much deeper. As you can see here, those kind of sit up alongside the tibia and are rarely injured in kind of typical sporting situations. This is the medial or the inner aspect of the heel. Again, still in this heel area to think about here. This first band of tissue is what we call a retinaculum. It's basically a brace or a support that keeps the underlying tendons in place. If we hide that guy and hide this one, now we can start to see some more of those tendons coming through the inside of the ankle. This area is specifically referred to as the tarsal tunnel. First, you have the posterior tibialis tendon, then you have the flexor digitorum longus tendon, and then you have the flexor hallucis longus tendon, all passing through this region, honestly pretty darn close to the Achilles tendon. And while they're rare, you can have ruptures of, especially this posterior tibialis tendon that we see sometimes, and so you can end up with pain in this heel area from a rupture of those tendons. We do also have some key nerves and blood vessels that run through this tarsal tunnel, and so when we have a severe injury around the ankle here in the heel, we have to always be aware of damage to those structures. Now, if we flip over to the outside of the ankle, this is where we're gonna find our perineal tendons and more of our kind of lateral ankle sprain type ligaments. We have two primary ones, the peroneus longus and the peroneus brevis, that run down and insert on the outside and kind of under surface of the foot. Again, these tendons can become injured traumatically. We heard about Von Miller. He actually had a dislocation of those tendons where these two little retinaculum that again keep that tendon in place basically tore and the tendons slip out. So while I'd expect this to be explained as an ankle injury, it's pretty darn close to the heel, can still kind of be in that differential. Finally, now if we kind of look on the undersurface of the heel, this is where we find our plantar fascia. That's this band of connective tissue that runs from the undersurface of the calcaneus up down to the toes and provides that kind of deep-sided support of the arch of your foot. This is, of course, what Goran Dragic tore in the NBA playoffs. These patients are going to have a lot of pain, but instead it's going to be on the undersurface of the heel, specifically that point where you make contact with the ground. Now, we also have a number of muscle layers that come from the calcaneus and then run up into the foot. These are the intrinsic foot muscles, but much lower on the list in terms of kind of acute sudden injuries that we would see in an athlete. If I'm there evaluating Klay Thompson on the court, my first question is going to be, where is the pain? If he's able to localize specifically where he feels pain, whether it's in the back of the heel, the undersurface of the heel, the inside, the outside, kind of deep inside the ankle, higher up near the shin, that's automatically going to kind of hone in my differential in terms of what I'm suspecting in my mind. You start really broad, you work your way down based on your history and based on your exam. The second thing I'm going to ask is, what do you remember happening? What were you doing? What did you feel? We all, of course, know that with an Achilles rupture, oftentimes players feel a pop. They feel a snap. They usually look down. It feels like somebody kicked him in the back of the leg. So if he comes to me and he says, gosh, doc, I've got pain right here on the back of my heel. It hurts like heck when I push off, and I felt a snap and a pop, I'm gonna be thinking Achilles rupture and really kind of narrow the rest of my questions and exam towards that. If he tells me that the pain's on the bottom of his foot, as I'm doing my exam, I'm gonna push on that area of the plantar fascia. If it's sore where I'm pushing, then now that narrows the differential down even more to kind of that plantar fascia. And then I'm gonna work my way through my typical physical exam. I'm gonna start with inspection. I'm gonna look at the skin, I'm gonna look for bruising, I'm gonna look for swelling. Sometimes with an Achilles rupture, you can even see a kind of a dent in the back of the leg where that defect is in the tendon. So I'm gonna inspect the area really well. Next is palpation. I'm gonna push on these key different structures all around the foot and also all through the ankle and up by the knee, because you have to examine the joints on either side to make sure there's none of that referred pain. Again, if I find a tender spot, I'm pushing where all these different key anatomical structures are, and if they're sore, that can be a sign of injury. Next, I'm gonna check his range of motion. I'm gonna have him plantar flex his foot down, dorsiflex the foot up, invert the foot in, evert the foot out, and if there's limitations in any of those movements, then it tells me that some of these tendons could be injured to where that connection isn't there between the muscle and the movement. Next, I'm gonna check the strength. I'm gonna check those muscles in the lower leg. I'm gonna check the muscles in the foot to see, again, maybe there's a nerve injury. Maybe there's, again, problem with a tendon to where you can't provide that full strength. Then I'm gonna do my special tests. These are the things like the Thompson test for an ACL, external rotation test for a high ankle sprain, tib fib squeeze test, and so on, again, looking at specific tests that are designed to pick up injuries in different areas. So assuming here that the Warriors had some medical personnel that were able to examine and evaluate him, just from that piece, you've already got a good idea in terms of what you're concerned about and what your differential is. But then you gotta get the tests. You gotta get x-rays to look for fractures, to look at the bones really well. You're gonna get some sort of soft tissue imaging like an MRI or an ultrasound to look at things like the tendons, the ligaments, and the muscles, and then come up with your diagnosis. It's really hard to say what could be going on here, guys. Again, the reporting's been kind of all over the place. Certainly seems to lean towards severe because people just have a tendency to kind of catastrophize things. We saw, according to some sources, the injury looked bad, but neither could say catastrophic. Some reporters reached out to his dad, who again didn't really shed much light, but didn't seem too optimistic. And of course, anytime something's so bad that a guy can't put weight on it, something's hurt. Something's injured, you just gotta figure out what and what the severity is. Last thing here to address this question of coming off the ACL tear, a lot of times when athletes have a specific catastrophic injury or surgery, it's easy to focus really hard on rehab of that one particular joint, that one particular injury. Sometimes what happens then is you forget about the other side. You strengthen the quad, you strengthen the hamstring, you get really good range of motion on the surgery side, but sometimes it can be easy to neglect and forget about that other side, to where now your surgery side is really strong, really effective, but the other side isn't actually in as good a shape. A big thing with injury rehab is asymmetries. And so if you have stronger thigh muscles on one leg compared to the other, you have differences in range of motion. Those are all going to be factors that can make it more likely to have an injury. Now, things that are very acute, sudden, traumatic, like what might have happened here, are sometimes a different story, but there is definitely a chance that whatever's going on here could be related to his previous injury, even though it was on the other leg. So my fingers are crossed for Klay here. Hopefully we get some good news in the coming days. Again, he's got something. He's hurt in some way. It could be as minor as simply a contusion to the heel, like we saw Anthony Davis have in the NBA playoffs, or it certainly could be something more catastrophic and potentially season-ending, like an Achilles rupture. That's it for the video though, everybody. Thank you as always for watching. Let me know any questions or comments down below. And until next time, we'll see you later.